Let's talk about urinary incontinence. Urinary incontinence is when you leak urine and you can't control your bladder the way you would like to. You can leak during the day, you can leak at night, you can leak when you cough and sneeze. Many people see overactive bladder commercials where people say, I gotta go, I gotta go. That's a type of urinary incontinence called urge incontinence. Stress urinary incontinence is when you actually leak when you cough or sneeze, or more importantly, anytime you increase your abdominal pressure, such as picking up something, lifting. People who have medical complications, they can have things called overflow incontinence, when the bladder continually fills and they can't void appropriately. Another type of urinary incontinence is urinary dribbling or intrinsic sphincter deficiency. The small little sphincter muscle between the bladder and the urethra, or the tube that comes out of the bladder, actually is damaged some way during childbirth or just from aging. Urinary incontinence is not simple. Just because you leak urine doesn't mean that you leak urine for one cause. The most important thing if you have urinary incontinence is to get a full, complete workup. The best approach is evaluating with urodynamics. Urodynamics is a simple, office-based test that allows us to determine how your bladder functions. Another way to evaluate the pelvic cavity is through ultrasonography, so that we can identify whether there are any other organs or any other structures that are pushing on your bladder, causing you to leak urine. For patients who have overactive bladder, we can help them with multiple different methods. One, we can use medications, but if medications are not effective, we can use a new device called InterStim, placing a small electrode near the nerves of the bladder to help control symptoms. For patients who have stress urinary incontinence, the gold standard has become the transobturator sling. It's a simple, outpatient procedure that allows us to control your urinary symptoms in regards to leakage with cough, sneeze, laugh, and picking up heavy objects. The great thing about urinary incontinence is that with the appropriate workups, we have appropriate cures. We can help you.